The definition of recurrent pregnancy loss is technically 3 clinical miscarriages. And a clinical miscarriage is a miscarriage or a pregnancy that gets to the point where you can see something on ultrasound or a tissue diagnosis if someone has a loss. So technically a home pregnancy test and then a negative pregnancy test or a late period is not technically a clinical miscarriage, but as a provider and talking to my patients, I know that that is still a huge sense of loss. American Society of Reproductive Medicine says that if someone's had 2 clinical miscarriages, it really makes sense to do an evaluation, that you don't have to wait for that 3rd loss to start an evaluation, so that if there's something that you could find and treat, you might be able to prevent that 3rd loss. Patients often ask why they're coming to Pacific Northwest Fertility for recurrent pregnancy loss, because they often say, I'm not having any problem getting pregnant, why am I coming to you? What patients don't realize is that we are the experts in recurrent pregnancy loss. We are OBGYNs that went on to do subspecialty training, and a big part of our training is recurrent pregnancy loss. So the first visit for a patient with recurrent pregnancy loss at Pacific Northwest Fertility involves a thorough discussion of the patient's history, including their medical history and their losses and lots of detailed information. We do a lot of education in that first visit. I think it's very important for patients to understand the common causes of miscarriage, a lot of the testing that we can do. And something that's very important to take home from that first visit is that there is a chance that we're not going to find that perfect answer. That 50% of the women that have a full, thorough evaluation for recurrent pregnancy loss are not going to find a perfect answer. And the reason is because the most common cause of miscarriage is aneuploidy, which means an incorrect number of chromosomes or a genetic issue at the level of the embryo. And that's not something that's going to show up on a test in mom and dad, but it's something that is completely random and that can happen with any pregnancy. So at the follow-up visit, if someone's being evaluated for recurrent pregnancy loss, we go over each test that was done very thoroughly, and if we find a reason that someone's having losses, then we can treat it. So if someone has a uterine septum or a fibroid in the uterus that's really causing recurrent losses, we can treat it. If someone has a thyroid issue that's causing losses, we can treat it. But again, most of the time we don't find that perfect answer, and we're explaining to patients that they might have unexplained recurrent pregnancy loss. And if that's the case, their options are really just to try again. That very next egg and sperm might be perfect and not have an incorrect number of chromosomes, and they'll have a healthy pregnancy. The only thing that I can offer, or intervention that I can offer for unexplained recurrent pregnancy loss, is to test the embryo before they get pregnant. So the technology in the field of in vitro fertilization has advanced so much in the last 5 years that we're now able to offer a new treatment for patients with unexplained recurrent pregnancy loss. Since the most common cause is an incorrect number of chromosomes or a genetic issue at the level of the embryo, we're now able, through IVF, to test the embryo before the patients get pregnant and to ensure that they're getting pregnant with an embryo with the right number of chromosomes and to improve their chances of success. After a thorough evaluation and a review of the test results, if patients are planning to try again for a successful pregnancy, we can also offer supportive care, which can just mean early blood tests, early ultrasounds, and really support patients through that first trimester, which is often the scariest for them, for anyone that's had a loss before.